I'm Dr. Amelie Ramirez.
Okay. And we could say that you're just with UT Health San Antonio?
Yes, that would be fine.
Okay. All right. So you released this book, or UT Health SA did, Advancing the Science of Cancer in Latinos 2024 Conference Proceedings. What's in there?
Okay, we have a wealth of information. We had a conference in February of 2024, and we invited Latino researchers from across the United States to share with us their latest research on the work that they were doing to help better improve the health of Latinos and help improve their cancer outcomes. And so this book is a compilation of the research that we learned, and we developed it in a way that's easy to people to read through and also access information and get new ideas in terms of where new research needs to go.
Yeah, and that's the other thing too. So for a lot of people, because the whole premise here is that when you look at the cancer numbers with Latinos, they're high, specifically with certain types of cancer, or with certain ages for Latinos. So if a regular person's reading this because they have a history of cancer in their family, they're Latino, they're here in San Antonio, and they want to read through this book and say, okay, you know what? I want to read this so that I know how to help myself and my family. What are their takeaways? What are they going to say? Okay, I could do this, this, and this.
Well, the biggest takeaway is number one, they have to get in for screening. Our population is being underscreened. You know, they're not going in for their regular checkups with enough time. And so cancer is being diagnosed at a later stage, which is much harder to treat. If you have cancer, you want to catch it at the earliest stages possible. So that's one of the areas. And the other is that behavior change is hard. And so you need to make a commitment. And New Year's is a great time, right, to start new commitments and wanting to change. And so really focusing on what are those things that can reduce your risk for cancer, such as, again, going in for your preventative screenings. Is your weight in check? And if not, what are you going to try to do? Because we're finding that obesity is a major contributor to cancer. So these are things that behavior change that we need still more research on, but these are individual things a person can do on their own. The other is how to get our community more involved in policy changes. You know, sometimes our cancer patients suffer due to food insecurity, or we know that a large portion of our population has no health insurance. What can we do as a community to make things better? Who do we need to talk to? Who in city council? Who in other places do we need to voice our opinion so that we can create a better change? And then lastly, if we do have cancer in our family, why aren't we getting genetic checkups to see if we ourselves are at risk for cancer? We need to ask our doctors, can we get a genetic screening so that I can better understand? Or if you do have cancer, your family should be getting their genetic screening to find out, again, what kinds of carriers they may be for those different types of cancer, whether it's breast cancer, prostate cancer, or other cancers.
Okay, I'm really happy that you brought that up. But where do you go from here with this book, with the findings that you have? Is there something that UT Health San Antonio is now going to city council members or commissioners court or something to say, hey, I'm putting this in front of you right now. These are the problems that we're having in our community. What are you going to do about it? Or how can we work with you?
Right. I really encourage them to go to our Salud America website because we have there a kind of a checklist to see how San Antonio is doing with regards to different risk factors, different social drivers of health. And you can take that and download it and share it with individuals in your own organization or, you know, city council or whatever level you would like to present that to. But it's designed to motivate individuals to take action.
One of the things that struck me when I was looking through the book is that you mentioned that it was the third point that you made about food insecurity and the situation that a lot of patients find themselves in when they're going through cancer. A lot of them maybe don't have access to that nutritious food. They're tired. They don't, or they might not have the support that other people with more resources have. Could you speak to that specifically here, since you treat people here in San Antonio?
Yes. One of the things that we're encouraging not only our clinicians within our own institution at the Mays Cancer Center and throughout the Health Science Center, but also getting our private care practitioners to be more informed informed about the needs of their patients. Are they having a food insecurity? What community resources can they link them to that maybe their patient hadn't thought about or may have been too embarrassed to ask? And so now we're asking our clinicians to get more involved in screening their patients for these social drivers of health, also called social determinants of health. But do they need help with getting to their appointments? Do they need, help with food and finding the resources here in San Antonio that we can connect them to? So we're trying to do more of that advocacy to encourage a better understanding of the patient's needs.
Now you're walking the walk, like when it comes to this, because you're also trying to, one of the other issues is that Latinos are not represented in studies. It also went over the racial, you could have Black Latinos, white Latinos, indigenous Latinos. And so that because of genetics, that could be a little bit complicated. And so you need a bigger sample, more representation of Latinos in medical studies so that we understand how they're affected. You're trying to do this right now.
Yes, we are.
How is this going? We spoke with you last fall about this. How's it going?
Well, we actually still need more help. Our Latinos are not speaking up, to tell us that they have cancer. We can find and identify some through what we call the Texas Cancer Registry, can help us identify some of the Latinos here in South Texas, and we reach out to them. But a large portion are not sure they want to participate in these studies. And without their representations and studies, we cannot improve what we have to offer. And they need to know that medications are based on the new development of medications that are coming out are based in people who participate in clinical studies or medical studies. And so if you're not there, your biology is not being represented in these trials. And our trial is really a behavioral trial. It's an observational trial. So we ask just a lot of questions of what was your process in going through cancer? How were your treatments? How can we help you better, so that we can support you in the future? And even that, we're still having individuals who are not sure that they want to participate. And so we're trying to get over that barrier because without their responses, we cannot design better programs to meet their needs.
So was there a certain amount of people that you needed for this study? And is this across South Texas?
Yes, we need a total of 1,500. We're at about 400 right now. So we need a lot more. I was out meeting with different clinicians out in Laredo and other parts of South Texas to really encourage them to make these referrals, or at least to inform their patients that this study is going on. We can now do it by Zoom. There's so many things that we've learned because we do have to get informed consent that it's okay to ask you these questions, and we have to have that verified. So there's a process that we go through, but we are now trying to simplify that. And after COVID, everybody learned almost how to use Zoom and or just the regular phone. And so we're finding lots of success, with those approaches. And so we're hoping that we'll get more that will participate.
And what are the requirements for this? That you had to have had cancer?
Yes, you had to have cancer within the last 10 years, no longer in current treatment, and be over the ages of 18. And be willing to share, let us contact your physicians for your clinical records.
Okay, and where can people go to sign up for this?
Sure. So number one, they can call us at 210-562-6514, or they can email us at caminos at, that's the long acronym for UTSCA, uthscsa.edu.
Perfect. Thank you so much for giving us all that information.